Varicella zoster virus and bad company. Introduction. Varicella zoster virus reactivation is a common infectious disease in neurology, and VCV is the second most frequent virus detected in encephalitis. VCV is currently the only recognized human virus able to replicate in cerebral arteries. Multiple studies have reported the onset of ischemic strokes after herpes zoster. In a study of 7,760 patients, after adjusting for other cerebrovascular risk, it was found that the risk of having a stroke increased by 31% post herpes zoster attacks, and approximately fourfold in the patients with herpes zoster ophthalmicus compared with the comparison cohort. It is theorized that the virus causes an inflammatory and thrombotic response. Case presentation. We present a 72-year-old Hispanic female with a past medical history of hypertension and recent herpes zoster who presented to the emergency department with a chief complaint of worsening mental status with right arm and leg weakness associated with multiple falls for the past 2 days. As per family members, she had a rapid decline in her mental status after being diagnosed with herpes zoster 1 month ago when she was treated with acyclovir and completed 3 rounds. On primary survey, she was tachycardic, encephalopathic, with herpetic lesions on her right mid to lower back around the T10 dermatomal distribution, and decreased right upper and lower extremity strength 2 out of 5 with normal reflexes. Laboratory results revealed normal chemistry, leukocyte count of 14,200 with neutrophilic predominance. CT brain scan showed no evident acute intracranial process. She was started on empiric therapy with vancomycin, ceftriaxone, ampicillin, and acyclovir due to concern for meningoencephalitis. A lumbar puncture was performed in the ED with cerebrospinal fluid analysis showing a cell count of 16 cells per microliter with 75% lymphocytes, a protein level of 122 milligrams per deciliter, and a normal glucose. Hospital course. After 6 days of hospitalization, the patient was not showing any improvement, and an electroencephalogram was performed due to concern for non-convulsive status epilepticus, which was remarkable for significant slowing with high amplitude waves consistent with global dysfunction. Brain MRI showed acute to early subacute left coronal radiata infarct, which is pictured to the left. CSF gram stain and culture was negative. CSF serologies for syphilis, HSV, VCV, and West Nile virus were negative, as well as VCV final culture. Despite controversial evidence, a trial of high-dose IV steroids was initiated due to patients' lack of clinical improvement with acyclovir alone. By the third day of treatment with corticosteroids, her mental status was back to baseline with residual right-sided weakness. After 20 days of hospitalization, she was discharged to an inpatient rehabilitation facility. Conclusion. Herpes zoster is an established risk factor for increasing the risk of stroke, especially shortly after infection. In conclusion, it is important to closely follow patients who have recovered from VCV infection and control modifiable risk factors for stroke, given the incidence of post-infectious complications related to VCV vasculopathy. Providers should continue to encourage patients to get vaccinated, especially those with high cardiovascular risk. References below. Thank you.